Hello everyone and welcome to our CERT C3HUB website demonstration. My name is Mary Mucko. I'm a specialist on the Provider Outreach and Education team at WPS GHA. I will be your host for today's webinar. Assisting me is my friend and colleague Ellen Vera, who will help during the question and answer portion of today's webinar. We begin this webinar as we do any other webinar that WPS GHA hosts, and that is with this disclaimer that you see now. We include this in all our education to inform learners that we made every effort to ensure that our education is current and accurate. This information, though, is subject to change. CMS publishes relevant laws, regulations, and rulings out on their website. Answers to questions are based on the facts given, but CMS published information and instruction, those rules, will always prevail, and this is what determines final Medicare coverage. CMS prohibits recording if any form of this presentation for profit-making purposes. We are recording this event, as I mentioned, and we'll post the recording on our Encore Presentations webpage, where it will remain about 90 days, and that recording will also be available on the WPS GHA YouTube channel until we decide to remove it. Today's event is a little bit different than our typical webinars in that it's going to provide an overview of the C3HUB, that is the CERT, the Comprehensive Error Rate Testing Program Provider's website. During this webinar, I will provide a demonstration of the CERT C3HUB website. Some of the things that you can expect to see, and just as we advertised, is how you can submit records to the CERT contractor, some sample letters, and contact information for the CERT contractor. I will point out some document request listings should you receive a request for documentation from the CERT contractor, and even more features and functionalities that are available on the CERT C3HUB website. So the CERT C3HUB website is maintained not by WPS or CMS, but by the CERT review contractor. And the company that is the CERT review contractor is a company by the name of Empower AI Incorporated. This slide shows the website address for the CERT C3HUB. That's the CERT provider website. And as you can see here on this slide, this website is really designed to provide all needed information related to the CERT program, the CERT process. For all of the stakeholders, the use of this website facilitates coordination, collaboration, and communication between the CERT contractor and the MACs, the Medicare Administrative Contractors, and also between the CERT contractor and providers. It is on the home page of the website that you will find all of the components that are listed in the left-hand menu, and I've included all of those in this list on this slide. And in just a moment, I'm going to begin demonstrating the website and showing each of these to you. But I did want to include a list in the presentation material so you can easily come back to this list if you want to know what the website includes. So if you're looking for some specific information, you'll be able to, at a quick glance, know if that is a component of the CERT C3HUB website rather. So as I mentioned, the next portion of today's webinar is going to be a demonstration of the CERT C3HUB website. And I told you that you can navigate to the CERT C3HUB website simply by adding the email address, or excuse me, the website address into the browser. That information was included on one of your slides today, earlier in this presentation. And I'm going to go ahead and enter that into the browser here. And actually I get, when I do the search, the first result is indeed the C3HUB, and it does identify CMS, even though it's maintained by the CERT contractor, Empower AI. Okay, so this brings us then to the home page, and you can tell that I'm on the home page of the CERT C3HUB because this blue highlighted area over on the left-hand list of menus showing that I'm on the home page. Another thing you can do if you're out on another website, such as the WPS website or CMS website rather, is you can simply do a search. This time I'm doing CERT. And this brings up for you all of the information related to CERT. But if you're specifically looking for that CERT C3HUB, you can enter that into the search feature and you will find additional information related to CERT C3HUB. But I used the actual web address in order to find this, find the home page of the CERT C3HUB. So this is what I'm showing you now. The home page includes menu items on the left, and I'm going to make it a little bit bigger here so it's easier for you to see. It includes menu items on the left and lists the website features in the center of the page. So right here in the center is a listing of all of the items that appear here in the left-hand menu. So in that center of the page, you'll see a brief description of those various features. And to link to the desired feature, you'll need to choose from the menu here on the left-hand side of the page. So you'll find helpful announcements also if you're on the home page, and you can find those simply by scrolling down on the home page to see those important announcements that were placed out there by the CERT contractor. So let's take a tour of those features on the CERT C3HUB website, beginning with this one titled About CERT. This provides some background on the CERT program, about the CERT contractors. It also provides the CERT process information and responsibilities of the CERT contractors. As you see by scrolling down the page, you can find information on both the CERT review contractor, that's the CERT RC, and the CERT statistical contractor, the CERT SC. So this provides for you a variety of functions that you can find that relate to both of these contractors. You can see that the CERT RC provides a variety of functions, such as creating the CERT sample, requesting records, imaging records, and so on and so forth. And then the CERT statistical contractor, scroll down a little bit here, actually move my cursor down. The CERT statistical contractor is the CERT contractor that's actually responsible for calculating the improper payment rates. So this information here under About CERT provides a few examples of the responsibilities specific to those contractors. The next feature on this tour today is Submit Records to CERT. And this page shows the ways you can submit documents to the CERT contractor. You can find all of the necessary details to send records via postal mail, fax, electronic submission of medical documentation, referred to as SMED. You can see the acronym here in parentheses. And there's also information on how to send records via CD or via encrypted email. At this time, providers cannot use the CERT C3HUB to register or to log in and send those documents directly through the C3HUB, but we do know that this is something that CMS has asked the CERT contractor to make available. You might notice up here in this upper right corner there's a MAC login, so Macs can use this to easily exchange documentation and records back and forth using a secure portion of this portal, but that is not currently available for providers. Next, I want to talk about letters and contact information, and this may be of particular interest to some of you based on those questions that you submitted during the registration process for this webinar today. So I'm going to try to include all of the information you need to answer all of those questions for those of you that submitted them during the registration process. This feature, as you can see, is titled Letters and Contact Information. And this is where you will find the initial and subsequent request schedules for the CERT review contractor. When the CERT review contractor is issuing that additional documentation request or ADR letter in order to obtain medical records for each of those claim lines sampled for CERT review. These are the requests for medical record documentation, as I mentioned, and there's a schedule. Should the CERT review contractor not receive your records within a particular time period, there are additional contacts made to follow up on those requests or to offer assistance to the provider that received the additional documentation request letter. So again, when you scroll down, you'll find a lot of great information as it relates to letters and contact information. You will see here that all first additional documentation request letters or ADR letters for CERT are sent to the correspondence address on file with the provider enrollment, chain, and ownership system, or what we call PACOS, for that provider that's listed on the claim. So all first ADR letters are sent to that correspondence address. If you choose to do so, you can contact a CERT customer service representative to request that all subsequent letters be sent to an alternate address. The telephone number for doing so is right here on this page. I'm going to try to highlight it here just for a moment. So if you've already received an initial ADR form from the CERT contractor for documentation, that letter, of course, is going to be sent to that correspondence address on file, but you can call customer service, the CERT contractor customer service, and ask that any subsequent ADR letters be sent to an alternate address. I know this was one of the questions that was submitted, to which address does those letters go, and how can we streamline that process? This is the process for doing so. You can let the CERT contractor know to which address you want those letters to come, and then it will be up to you within your organization to set up those procedures to follow when you receive those additional documentation request letters. What are you going to do within your office? What types of protocols are you going to implement so that those requests get to the appropriate staff and can be returned, those records that is, to the CERT contractor on a timely basis. So there is the telephone number for you. There's also information on this page about what the CERT refers to, the CERT contractor that is, refers to as the chain address program. This is for providers who have multiple billing numbers, at least 5, who would like to elect a single point of contact. At the bottom of the page, you're going to find additional information about how the CERT contractor makes contact when multiple calls are due to the same phone number, and that's what you can find here under group calls. So we have the chain address program, and then of course we have some information about group calls. So this is when multiple calls are due to that same phone number. In this case, what happens is the CERT review contractor will group those calls so a single contact can be made to discuss all of those outstanding record requests. So some great information on this page, the one titled Letters and Contact Information. This will provide answers to some of those questions that you folks asked when you registered to attend this event. Specifically, where does the CERT letter go to and how can we streamline that process? I would recommend that you do give a call to the CERT customer service area and ask for your subsequent ADR letters to be sent to an alternate address. And then, of course, it's up to your own organization to determine what happens once that request letter gets to its destination. All right, next up is a completion status chart. And this is a web page that the CERT contractor has added to their website to show the status of the active report periods that the CERT review contractor is working on. So you can see for 2023, it gives you the claim submission dates for the 2023 report year, CERT report year. They reviewed claims that were submitted July 1 of 2021 through June 30 of 2022, and we know that the CERT contractor has now completed their review. Similarly, you can check status, or completion status for the active report periods for report year 2024. They're working on that currently. Those are claims submitted July 1 of 2022 through June 30 of 2023. They do review claims with the oldest submission date first. They prioritize those. And then, of course, they are working on review of claims for the report year 2025. And you can see the status for that here on the left side of this page. So that is completion status. Here is another feature on the CERT C3HUB website, but this one is called Claim Status Search. And this feature allows a provider to view the current status of a claim under CERT review. What you would need to do in this case, over here on the right side, you can see where it says enter a CID to view its current status. A CID is the claim identifier. It's a 7-digit number, and the CID is located on the bar-coded cover sheet that you receive with an additional documentation request letter. So that's where you'll find that CID to enter here on the claim status search in order to view the claim or the current status of a claim under CERT review. The next feature is one that was added a short while back. The CERT contractor added this feature titled CERT Disaster Damage Administrative Relief to their website, and this is for those cases where there is a disaster. In that case, the CERT program does sometimes grant a temporary administrative relief to any of those providers or suppliers affected by that disaster. So if there is a disaster in your area, I would recommend that you come out and take a look at this feature on the CERT C3HUB website to see if there is any resources that you can look to, or to see what types of temporary administrative relief has been granted. Next up is attestation letters, and this information is for cases where the provider is unable to provide documentation because the needed medical record was completely or partially destroyed due to a disaster. So there are some, attestation letters that you can use for those particular situations. This is at the top of the page for attestation letters, and a definition of disaster is provided by the CERT contractor. When you scroll down this page, you will find links to CMS signatures for medical review purposes, or signature guidelines, I should say, for medical review purposes. You can also choose to click on a link for a copy of signature attestation forms. They're here in the page. This is that information I just mentioned that provides those signature guidelines for medical review purposes. So all things relative to these signature attestation statements that you may or may not need to use. You can also find on this particular page those links for copies of the attestation forms. And those, you can print these and fax these to the CERT Customer Service Center if needed. Next up is samples of the request letters. This is the next feature that I'm going to talk about. This web page allows the user to click on links to download sample request letters, and you can do so in either English or in Spanish. In the interest of time, I'm not going to click on these, but you can do so after this demonstration if you wish. The CERT contractor makes these sample request letters very easy to find. Just use the left-hand menu item sample request letters and you'll find them listed here. Keeping in mind that Part A is separate from Part B. There's a durable medical equipment, a DME initial letter, there's a chiropractic services letter, and so on and so forth. You can see them listed there and take a look at them later on if you wish to do so. In the center of the page, kind of on the center, left center of the page, the CERT contractor on this sample request letters page provides an example of the envelope that all letters are delivered in, and you can actually click on it to enlarge it if you'd like. Okay. The next feature that I'm going to talk about is one that is extremely valuable to providers, and that is document request listings. Providers often ask what documentation needs to be sent when they receive a request for medical records. These document request listings here provide a list of provider and billing types, and what I'm talking about is here. Durable medical equipment. These are the document request listings related to DME, durable medical equipment. We also have specific document request listings relative to Part A claims, and then the same document request letter listings for Part B. This provides, of course, as I mentioned, a list of provider and billing types. So when you find the type you want, you simply need to click on it and you can save a document that lists the documentation that is required to support payment on a Medicare claim. While these are printable, you do need to remember that the required documents or the listings of documentation are subject to changes by CMS, by the CERT contractor. So if you need to print these, be sure you check back to confirm that you do have the most current version. And I'm going to pick one out for you specifically. Let's take a look at emergency room physician services. I'm going to click on it, and this will provide an opportunity for you to download the document that shows a description. I'm going to enlarge this just a little bit while I'm talking here. Provides you with the document description of what you need to submit to the CERT contractor if your physician emergency room service is selected for CERT review. Diagnostic test results, reports, include the imaging reports, include progress notes, and so on and so forth. So this is some very good information, very valuable information that I think all providers will find particularly useful, and that is located here under Document Request Listings. For those providers who bill for mental health services, specifically psychotherapy services, the CERT C3HUB website includes a feature that pertains to Psychotherapy Notes, and it is on this page. You will find a link to some CMS, right here is the link, to some CMS special instructions for providing documentation for psychotherapy services or psychotherapy claims. So if you submit those services to Medicare and your claim is selected by CERT for review, you'll want to check out these notes here. Next, you can find and view the CERT holiday calendar. This shows when the CERT Customer Service Center will be closed. You can scroll through those if you're interested or filter. Next is FAQs. And here's where you will find answers to those most common questions about the CERT program or about CERT. It's categorized. You can find some a general category listed. Moving down, scrolling quite a bit. When you scroll down, you'll find other categories. Here's a category, documentation from referring and ordering providers. There's also another category, I'm not going to scroll there now, that's called submitting documentation. CMS Links is the next feature on the CERT C3HUB website. And this is a listing of links to helpful CMS information that pertains to the CERT program and to the CERT process. There's a PowerPoint you can view about CERT. There's information here about their customer service and outreach. Other information that links you back to specific information, those psychotherapy claims, that information that I mentioned. They're included on this page links for information about encryption of sensitive information. So a lot of great links to CMS valuable information is here on this website. And last but not least on our little tour of the CERT C3HUB is Contact Us. And this web page provides contact information for the CERT Documentation Center. You will find their fax number, their customer service number, as well as an email address if you need that. All right, get my cursor here, moving this page over out of the way. We're going to return to the slide deck. At this time, I'm going to open it up for questions, but before doing so, I want to answer a couple of questions that I've gotten in the past that have been particularly useful or helpful to providers, I think. We had a question from a provider that mentioned that the CERT C3HUB and the WPS website, where you can check CERT claim review status, had some conflicting answers. For example, the hub said the review was complete, but the WPS CERT claim status lookup stated that the review was ongoing. And the provider is asking why this happens. The information that I received or got then from our medical review staff that focuses on CERT is that the C3HUB is updated real time as soon as the review is completed. And after CERT sends WPS the information and we process the case, then we upload files to our CERT claim lookup tool. There will be a short delay in the status update on our CERT claim lookup tool for this reason. We also want to make certain, of course, that we validate the decision before posting. I'm going to show you that WPS CERT claim lookup tool here. I'm going to bring this back over. I'm just going to use the search. I'm a searcher, not a navigator. So if you're ever in one of my webinars, you'll see that I particularly like to use the CERT function. This is what I'm talking about, and it's comparable, if you will, to that CERT claim status lookup that I talked about and showed you on the CERT C3HUB, where that is where you enter that CID, that claim number, that 7-digit number that's found on the barcoded sheet that's sent out with your medical records. You enter that and hit your search key, and the CERT contractor brings back status. We have a similar tool available on our website. We call it the CERT claim lookup tool. You do the same thing. You enter your CERT claim number, your CID, and click on search, and it brings back responses. Is the review complete? Is it in process? Is it not valid? And what we mean by that typically is that CID number that's being entered here in this box. It's a 7-digit number. I'm just keying some numbers here. If you transpose something there, then your status that comes back is going to be invalid. So that's what invalid means. It could also mean that the CID that you have entered was actually included in a previous CERT report period. This claim lookup tool will bring back responses or status on those claims that are currently being reviewed, not from a prior CERT review period. And I mentioned those CERT review periods, those date ranges for claims submitted when we looked out at those claim status charts out on the CERT C3HUB. Now, the reason I'm showing you this is because based on provider feedback, and we're kind of tooting our own little horn here, the information that you can bring back on our CERT claim lookup tool includes far more details than what you're going to get on the CERT C3HUB. We have recommended to them that they expand on their details, but so far we continue for the most part to see that the information brought back using the WPS-GHA CERT claim lookup tool is far more detailed than that you can find here, claim status search on the CERT C3HUB. So just something to keep in mind. If you're using the CERT C3HUB website for claim status search and you want more information, you might want to take a look at the CERT claim lookup tool on the WPS-GHA website. So just some information there for you. One of the questions that was submitted when you registered for today's event is, what is the follow-up after CERT results are published? I'm not really certain what this question means, but I can tell you as a contractor, we have dedicated staff that will meet and discuss those CERT errors that the CMS or the CERT contractor has found, and then we determine what is the best way to go about providing education that will prevent those errors from occurring in the future. Another thing we do is follow up after CERT results are published is we actually publish, I could show you that too here. I'm going to bring back this. I'll look at the WPS-GHA website, and I just searched for CERT. You'll see a number of matches, if you will, that come back. So a lot of these are articles that speak to those CERT results. So this is kind of how we publish. But the one thing that I want to specifically bring to your attention is right here. Quarterly CERT error finding reports. You can find these by calendar quarters out on our website. You can take a look at our J5A errors, J5B, J8A, J8B, and these are really informative. And just on Tuesday of this week, I hosted a webinar that talked about the CERT program and the CERT process. And I mentioned that these CERT reports that we publish, I'll make it a little bigger here, actually provide some detailed information, not too specific, because we have to be careful of what we can and cannot share due to the HIPAA laws and such, Health Insurance Portability and Accountability Act. But this provides a summary on a quarterly basis of the CERT error findings. So if within your organization you have a training team, an audit team, or a compliance team, this is good information to take a look at and maybe pull some records within your organization for these particular services where there have been findings, and make certain that your services are being billed correctly. So, kind of an indicator that maybe these errors that we're providing here might be a good place to start for some self-audits. Okay, so some great information in these quarterly reports are available. Okay. How the process works, I mentioned that I held a webinar on Tuesday. This particular webinar today did not advertise that we were going to talk about the CERT process. It's basically a demonstration on the CERT C3 website, but we did record the webinar on Tuesday that covered that CERT process. What are the steps in the process? And that recording will soon appear on our Encore Presentations webpage, so you can listen to that if you didn't get an opportunity to do that on Tuesday, or if you want to listen again to all or parts of it. And we also post our recordings out on the WPS GHA YouTube channel, so something to keep in mind. The last pre-submitted question before I open it up to new questions live today is, will the C3HUB ever have the official demand letter with rationales? And really that's a question for the CERT contractor. We are not the CERT contractor. We don't dictate the information. we just simply send out those requests when they asked us to. So I don't know that the demand letters are going to include rationale in the future. Certainly that this is a question for the CERT review contractor, or actually for CMS. If CMS provides direction to the MACs that that information needs to be in there, then they will include that, of course. So those were just a few of the pre-submitted questions. One other question was streamlining receipt of those documentation request letters. And I really did talk about that already when I showed you the CERT C3HUB website and talked a little bit in depth about letters and contact information. This is the information you need to pay special attention to if you're looking for ways to streamline receipt of those documentation request letters. All right, at this time, Ellen, I'm going to ask you if we have received any questions so far about this CERT C3HUB demonstration.
Mary, we don't have any questions at this time.
All right. All right. You've been a great audience. On behalf of myself and Ellen and all of Provider Outreach and Education, I do want to thank you for your participation today. We look forward to your survey comments, and we hope to have you join us for future events. You may now disconnect.